In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And with me today in the studio is Dr. Joachim Spranger from the Department of Endocrinology, Diabetes and Nutrition at Charité Hospital here in Berlin. Welcome, Dr. Spranger, to In Good Shape.
Thank you.
The BMI, what's your opinion about this as an indicator of being obese or overweight?
Well, I think it's a very established factor. There have been a number of studies, huge epidemiological studies into investigating the relation between BMI and cardiovascular risks or risk for heart attack. So I think that is a marker which can be measured very simply, so the patient himself can do that and the clinical doctor can use it. So I think it's an established marker and we should use it.
Okay, so you don't even need to see your doctor to establish your BMI then?
Absolutely, you just have to measure your weight and your height and that's it.
And then you can go. And how effective are other methods of detecting being obese?
Well, we know that we have an area between BMI 25 to 30, where we certainly have to differ between the patients. So they may have a high muscle mass or a high fat mass, and still they have the same BMI. So at that point, we needed different methods, for example, to determine the fat mass. We have just seen the bioimpedance method. That is very flawy, to be honest. It's widely used, but still flawy. We have other methods like MRI, for example. That's very precise. That's kind of gold standard. So there are different methods, but for the clinical practice, really BMI and I think waist circumference are very helpful.
I mean the MRI, you need to go to see your doctor, and it's a very expensive, big machine.
Absolutely, it's just for studies.
It's just for studies then,
yes.
Yeah. So when does being overweight become a health problem? What's the point, what's the cutoff point you would say you're overweight and this is dangerous to your health?
Well, we see the lowest risk for mortality, and I think that's the most important point, at the BMI between 23 and 25. Above 25, we see an increase of risk. Above 30, there is certainly a considerable risk. And we should also consider the waist circumference, so waist circumference above 102 for men or for 49, that has been said here in the report. We know that there is an increased risk. Above 102, there is really a considerable risk.
So you can measure your wrist size by yourself, and to measure your waist correctly, run the measuring tape around your body, around your waist, around the navel, and the men's waist should not exceed 94 centimeters, and the woman's waist should not be more than 80. Is it better to be a little bit chubby, perhaps?
I would not say better. As I said, the best is a BMI between 23 and 25, but I would say the risk is not that high if you have a BMI of 27, but no other risk factors.
Dr. Spranger, what do you make of intermittent fasting? Do you consider it a good thing?
Well, I think it's one of the methods we have, actually. There are a number of diet forms, and one person likes the one and one does like more the other. You showed perfectly in your report, actually. The lady does not want to do it anymore, and the man apparently likes it. So I think it's okay, you can try it, but in general, the diet has to fit into the familial and the social situation. And if that is given, you have a good chance of success.
So what advice would you give to the woman who was not able to continue the diet?
As I said, probably we would have to sit together and look what her familial situation is. In her situation, I think that's important. What they are doing is a very low-calorie diet from day to day. And in that situation, you need really medical advice and a medical doctor who is looking at your lab values, etc., because there is a risk of acute complications, as the lady had. She had diarrhea, and that is not a rare complication. So you really have to do that together with a medical doctor.
So if you want to skip some calories and don't take too many calories a day, you can just skip your dinner, which is called dinner cancelling. We got a question about this from Canada. Cecily Fast wants to know, what's your opinion about dinner cancelling?
Yeah, it works in quite a number of patients. I think that's quite useful. I mean, if you're eating in the evening, you don't burn it down because you're not moving anymore, you go to bed. And so that works in quite a number of patients. But again, it's not for everybody. Some patients say we like it and others don't.
And are not all calories created equal? I mean, is the calorie I eat in the morning of another value than the one I eat in the evening?
No, to be honest, a calorie is a calorie. It's just you have a different behavior in the evening than in the morning. You have a different hormonal situation. So still, some patients may really have a considerable benefit if they cancel the dinner. So that may work.
What about all those crash diets, the one where you like to lose weight very, very fast? Leon from Seoul in Korea wants to know, what's your opinion about those crash diets?
They work very well, to be honest. We
Really?
have done a number of studies with crash diets or very low calorie diets. So that's something like 800 kilocalories per day. And about everybody is going to lose weight in the first 3 months. The problem is always that after those first months, the people regain body weight, and that's the major problem. But that not only with crash diets, but with all diet forms.
Which is called the yo-yo effect. That means that, that you regain your weight where you started, or even put on some extra weight after a diet, the weight cycling thing. So how can you get rid of the yo-yo effect?
Very difficult. We don't have the answer to that yet, to be honest. We know that if you prolong your intervention, so if you change your lifestyle, and that's why it's so important to look at the familial situation, if you're able to integrate it on the long term, your lifestyle changes, you probably have a better chance. About 30% manage to reduce body weight on the long term. The rest, unfortunately, is successful at the beginning, but then regains.
And lifestyle changes doesn't just mean to change your diet, it means getting into exercise?
Absolutely, we think both is important. Even if you just do physical exercise, you may not reduce your body weight considerably, but you still improve your fitness, which is good for your health status.
Okay, Dr. Spranger, thanks so much for being with us and in good shape. Thanks.
Thanks very much.